Hi everyone, welcome back to Pediatrician Brothers. I'm Dr. David.
And I'm Dr. Konstantine, and today we're going to be diving in common nutritional issue, which is iron deficiency.
You might think that this is only an issue in poor countries, but that's not true. Even in US and Europe, many children, especially toddlers, don't get enough iron, and that can seriously impact their development.
Iron helps the body to transfer oxygen and support the brain development, build a strong immune system, but when iron is low, especially in growing kids, it can lead to fatigue, poor growth, learning delays, and even behavioral issues.
Sometimes there are no obvious signs. Your child might look fine, but still there can be a deficiency in this crucial nutrient. Babies who are born early, were small at birth, and whose moms had iron deficiency anemia during pregnancy are at higher risk.
Yeah, and after 6 months of age, breastfed babies who are not getting supplementary feeding might be at risk of iron deficiency because they need a lot of food enriched in iron. And breast milk is amazing, but it doesn't have a lot of iron stores to share with the baby.
Toddlers who drink too much cow's milk and not enough solid food are also at high risk. More than 2 cups of milk a day can also cause and aggravate iron deficiency.
So what are the red flags? There are a few signs that parents should look for: pale skin, tiredness and low energy, irritability, slow growth, craving for things that are not nutritious, which we call pica.
And even without signs, your child could still have iron deficiency, so it's important to screen the child at the right ages. Guidelines recommend screening for all babies around 12 months with simple blood tests to check hemoglobin. In higher risk babies, we might screen even earlier, and in conjunction with CBC, we can use ferritin test.
If your child has anemia, then meaning that there is low hemoglobin and their iron stores are low, then they are likely to have iron deficiency anemia.
Yeah, we sometimes start iron treatment right away and watch how they respond. If hemoglobin rises in few weeks, it usually confirms the diagnosis.
Here are a few tips how your child can stay iron sufficient. First, start iron-rich solid foods at maximum of 6 months. Second one, include iron-fortified cereals, pureed meats as soon as possible in daily diet. And third one, you can pair these iron-rich foods with vitamin C-rich products like orange and tomato to help with absorption.
And please avoid giving whole milk to the child under 12 months. After that, you can limit it under 2 cups or 500 milliliters of milk a day. Remember, too much milk equals low iron. Child is diagnosed with iron deficiency anemia. Don't panic, it is treated easily.
Usually we prescribe iron drops or syrups taken on empty stomach or with juices, and typically we check if the iron and hemoglobin levels improve by the end of the month.
And remember, iron therapy can continue for at least 3 months to rebuild the iron stores, even after hemoglobin returns to normal.
If your child doesn't respond to iron, there could be something else going on, like blood loss, malabsorption, or even inherited hemoglobinopathies like thalassemia.
That's why follow-up is so important. Pediatricians will guide you through the testing process if it is needed. Iron deficiency does not just affect blood, it may affect how your child grows, how your child learns, and it can even affect the immune system, because during infections it is very important to have the iron stores in the normal range.
Some studies also show that it is linked to attention issues, slower motor development, and etc.
Iron deficiency is one of the most preventable health issues in childhood, so don't be afraid.
Yeah, if your baby is approaching 6 months, contact your pediatrician, and they're gonna guide through the iron-enriched foods that might be needed as complementary feeding.
And don't forget, like, comment, and subscribe to our channel if you liked our video.
See you next time.